If you have times where you feel detached from your body or the world around you to the extent that you feel like you're in a dream, or you're watching yourself from a distance, or you just feel really numb, or like things are moving faster or slower than normal, or you have complete gaps in your memory where you have no idea what's happened, then it might be that you're experiencing dissociation. I'm Dr. Danielle Crane, I'm a clinical psychologist, and in this video I'll be talking a bit about what dissociation is, why we experience it, and how to manage it. We all experience dissociation to a certain extent. It's that feeling of driving somewhere, getting to the destination, and then thinking, I can't actually remember parts of the journey. I must have been on autopilot during that time. We've all had those experiences, and often they don't affect our ability to function or don't cause us distress. But there are also other people who experience those to a much more severe extent or much more frequently, where it does cause them distress and it does make it difficult for them to function. The two main examples that we tend to see are people with post-traumatic stress disorder, where difficult memories can cause them to dissociate, and it can get to the extent where they might resort to destructive behaviours just as a way of trying to allow themselves to feel something or trying to snap them out of that dissociation. Another example is dissociative identity disorder, where people may experience dissociation to such an extent that they may not remember entire days, and other personalities are likely to have come forward during that time when they've been dissociated. So there's a whole range of different experiences of dissociation, and I'll put some information below giving you some more examples of what it feels like. These experiences tend to be divided up into depersonalization and derealization. Depersonalization is when you feel detached from your body to the extent that you might not recognize yourself in the mirror, or you might feel numb or hollow or like you're watching yourself from outside your body. Whereas derealization is when you are detached from the world around you. So it might feel like the things around you are unfamiliar or unreal, like you're in a dream, or you're underwater, or things are just moving faster or slower than normal. A lot of people struggle to understand why they dissociate. So usually it is a response to feeling overwhelmed by stress or traumatic memories. So your brain basically gets so overwhelmed that the only way for you to cope is just to shut down completely, or to detach from what's going on around you or your own body. So it's almost like a defense mechanism. It can also be the result of substance misuse. So sometimes if people are using substances like cannabis, that can cause periods of feeling dissociated. And the other thing is physical health conditions. So it's always important to get checked out by your GP to make sure that there's nothing physical that might be causing those experiences. There are things like absence seizures that can have a similar sensation to dissociation. So if you are experiencing dissociation, there's a few things that I recommend trying. Firstly is being aware of your triggers. So if there are certain stressful situations or certain reminders of traumatic memories that tend to trigger your dissociation, then it's important to be careful about your exposure to them. So it might be that if your traumatic memory relates to Christmas time, then you might decide not to have traditional Christmas music or traditional Christmas decorations, because that might make you more likely to dissociate, and you might pick things that are less traditional. The other thing is about trying to remind yourself that that dissociative experience isn't going to last forever. It is a temporary experience. I think often when people feel that way, they can feel very anxious about the fact that they're dissociating and can feel a sense of urgency to try and get rid of it, and also can feel like it's going to last forever. They're never going to feel, okay again. Whereas if you can try and accept that in that moment, that is how you feel, and that actually that feeling will pass, then it can help reduce some of that anxiety. The other thing is about trying to be focused on the present moment. So often when you're dissociated, you'll feel detached from yourself and the world around you, and you won't feel present in the moment that you're in. And so trying to make an effort to focus on the present is really helpful. It's part of our mindfulness skills. So you can think about, what things around you can you see, what can you hear, what can you touch and taste and smell, and really draw on all of your senses to be as present as possible in the moment that you're in and as present as possible in your own body. Sometimes we call that focus on the present moment and on your body and the world around you as a grounding skill. There are loads of other forms of grounding skills as well. So I will put a list in the description for this video, but there are things like chewing spearmint chewing gum, or holding ice, taking off your socks and shoes and walking around barefoot ideally on different textures or on cold surfaces, splashing your face with cold water, using smelling salts, listening to music, going outside, doing yoga or dance to reconnect with your body. There's loads of activities like that where it can help to snap you out of the dissociation and help you be as present as possible in that moment and in your own body. So different things work for different people, so you might have to try lots of items on that list before you find one particular activity that works for you. And you might also find that activity works on one day and doesn't work on another, so it's good to have at least a few of those set aside that you can use when needed. The other thing that can be helpful is to focus on your breathing. So dissociation is generally associated with an anxious state where we might be breathing faster than normal. And so I tend to recommend paced breathing, which is where your exhale is longer than your inhale. So if you were to breathe in for a count of 4, you might breathe out for a count of 6. Or if you were to breathe in for a count of 5, you might be breathing out for a count of 7. The exact numbers don't really matter. You can pick what works for you so long as your out breath is longer than your in breath. And that will communicate to your body that actually you can calm down, you can relax a bit, and it might help with the dissociation. It's also really important to take care of yourself in terms of making sure that you're sleeping enough, eating enough, that you're exercising regularly, because those sorts of things will reduce your vulnerability to dissociation. I've worked with a lot of people with dissociation where they found that actually regular exercise helps to ground them, helps to manage their anxiety and stress, and has reduced their dissociation significantly. So do try and be kind of careful about taking care of yourself. The other thing is avoiding substances. So drugs and alcohol, whilst they often have a short-term benefit on our mood or on relaxing us, it tends to actually make you feel worse in the longer term. So it's best to avoid those substances. I always recommend talking to someone about your experiences and about what you're struggling with. If you have a space to actually talk about your emotions, then you're less likely to feel overwhelmed by them and you're less likely to dissociate. If it's to the extent where you are dissociating frequently, or it's causing you distress, or affecting your ability to function, then I always recommend trying to look into therapy to see if that might be something that can help you. We do have specific approaches that work for dissociation. So if your dissociation is related to a trauma, then we have lots of trauma-informed therapies, like EMDR, for example, and we also, if you have dissociative identity disorder, we have therapies focused on that. And if you are finding that your dissociation is part of emotion unstable personality disorder, we often recommend dialectical behaviour therapy, which has a whole component on managing emotions and mindfulness and that sort of thing. So I hope that's provided a bit of an overview about dissociation. I will try and record some other videos in future about tips for managing dissociative identity disorder specifically, and also skills for managing the symptoms of post-traumatic stress disorder like flashbacks and nightmares. If you have any specific questions about dissociation, then feel free to put them below and I'll do my best to answer them. Thank you.